Hello everyone, I'm talking for lesson 11 for part 1 regarding 2/3 of funding for substance abuse centers coming from taxpayers. Does substance abuse treatment have external benefits that warrant this level of public funding? I said yes, using Lee's definition of that external benefits has a positive impact of a transaction for a consumer or producer not involved in the transactions. For those of us who are not going to substance abuse treatments, I have on the screen from the Federal Drug and Spending from U.S. Department of Health and Human Services, and then also Arrow Passageways. Although I agree with Arrow Passageway Recovery that more should be spent on prevention, especially for children, because the benefits to society for this is the partial income redistribution for substance abuse treatments is worth the cost if they do get it under control. The U.S. Department of Health and Human Services Substance Abuse and Mental Health stated that in the cost-benefit analysis that they did, looking at the information from the National Institute of Health, they ranked alcohol second, tobacco sixth, and drug disorder seventh among estimated costs of illness for 33 different diseases and conditions. And this is back in 2000. In their analysis, they proposed an average effective school-based program, so this is not all programs, just the ones for schools, of $220 per pupil, and they said it would save an estimated $18 per $1 invested if this type of program was implemented. So that's quite a bit of bang for your buck for doing these treatment programs. And having these programs will decrease societal costs. So we're getting the benefit as the people paying it, the taxpayers, because it's preventing death from these different things and increasing health, thereby it's maintaining the workforce. Treatment will decrease the burden of healthcare costs for the chronic condition. Treatment can help abuse people from becoming a generational type of thing. And it will also decrease the burden of law enforcement, which increases our safety. For part 2 of our question, self-regulation, I'm looking at what Board of Nursing does for and how they operate. So the role of the Board of Nursing, looking at the information from nursejournal.org, which is a Red Ventures company. State boards of nursing oversee all administrative aspects of nursing licenses for each state. They evaluate license application, issue licenses, renew licenses, take care of discipline action in response to professional misconduct. They work with the NPA by enforcing rules, regulations that are state-specific for the licensure and scope of practice in specific areas. And then the NPA gives each state board of nursing the authority to develop different administrative rules that help clarify the NPA standards for that state. Can't exceed the laws or anything, have to be written in the same spirit. And then once enacted, the state boards of nursing rules have the force of law for nurses, nursing students, and anybody else who's a stakeholder, that they can write to that state board and participate in hearings. So I have there, those 4 main functions of licensure, applications, issuing licenses, taking disciplinary actions, reviewing licenses. Who sits on the Wisconsin State Board is 9 people. 5 of them are registered nurses, 2 of them are licensed practical nurses, and 2 are public members. and you can look there and see who is actually on our state boards. And the board members are appointed by the governor, and then it's confirmed by the legislator. They serve 4-year terms. And like even the medical board has 9 people, they just have 3 people who are from the public. And that's a benefit because we are serving the public, so we want to be transparent and open. But also it gives them a chance to see that how we are operating, give us viewpoint from the public's viewpoint of who we are serving, and it helps develop that trust between the nurses and the public. Especially we don't think of nurses just as those in hospitals, those are in public health, private. We want to be transparent to each of them. And the ANA article also says, why we should, the same reason that we should be on boards for other places is the same reason we should have them on our boards. It makes it more accountability and more involved in the community.